Hello, yeah, hi, Dr. Santosh. Am I audible to you?
Yes, sir.
Yeah, am I audible, sir?
Yes, sir.
Yeah, you are visible now. Just a second. I'll make it live and then we can start with the session. Just give me 1 minute. Yeah, we are live, sir. We can start. Just open the PPT, sir.
Good morning. Understanding the glycemic variables.
So just rotate the phone, rotate.
Understanding glycemic variable in high carb diet, role of hemoglobin in Indian hypertension, type 2 diabetes. Agenda: diabetes burden, global and Indian. Indian carbohydrates burden, carbohydrates and glycemic variability. Clinical and impact of glycemic variability. Guidelines of recommendation. Role of SGLT2 inhibitor in glycemic variable. Hemoglobin evidence on GB and postprandial control. Hemoglobin is a special population. Type 2 diabetes, global epidemic and Indian is a large contributor. International Diabetic Federation. Latest update 2025, 589 million adults 20 to 79 years are living in the type diabetes worldwide. Carbs. Cause of the rapid rise in the diabetes in India. Here is here. Cause of the rapid rise in diabetes in India. Impact of the carbohydrate intake of glycemic control. In diet, there 62.3 of total energy from carbohydrates, predominantly from refined and cereals and added sugars. Interventional evidence support carbohydrate restriction. Supporting evidence from the and Indian prospective studies demonstrated that adoption of low carbohydrates in adults with type 2 as associated with favorable glycemic and metabolic improvement. The dietary intervention was linked to improved glucose regulations along with beneficial changes in overall metabolic profile. Together, these studies emphasize the both carbohydrates quantity and quality of important determinants of glycemic health. Glycemic variability. Glycemic assessment is in diabetic is a necessity for parameters behind the HbA1c. Here, paradigm shift in diabetes management from glycemic triad to glycemic patent. Glycemic variable and hypoglycemia are the potential important factors in causation of vascular completion in DF. Glycemic variability is a consistent predictor of glycemia. Hypoglycemia associated with significant morbidity in and increased mortality. Frequency and large glucose fluctuations independently contribute to diabetes-related complications. Increased glucose variability is associated with mortality in the ICU. Diabetes complications important of maintaining TIR. Increases risk of the third hypoglycemia and CV automatic dysfunction and macrovascular complication. Next page. Continuous glucose monitoring and time in range. The Journal of the Nutrition. The relationship between dietary pattern and glycemic variable in people with impaired glucose tolerance. Known fact: cellular glucose fluctuations are increased in pre-diabetes and might to be affected by specific dietary patterns. Aim of the study: the relationship between the glycemic variable and the dietary regimen in the people with a normal glucose tolerance and impaired glucose tolerance. Pharmacotherapy of diabetics as per the ADA 2026. Use of glucose lowering the medication in the management of type 2 diabetes. Effect of BD dosing over the OD in glycemic variable control. REMIT GV. Study design. Randomized to arm and parallel group open label. Treatment duration 6 weeks. Here the study flow. And the mean change in the continuous glycemic profile across 24 hours at baseline of phase 2. And the REMIT GV study conclusion. PPP hyperglycemia is an independent risk factor of CVD as shown further increase the risk of CV events and diabetic patients. Indian meals pattern high carbohydrates meals per day contribute to more PP hyperglycemia. Remagliflozin might be a better reduction glycemic variable with effective PP glycemic control in Indian hyper Indian type 2 patients. Use of SG12 and DPP4I combination for CVGV control. Triad RMV trials. Is the trial objectives excessive efficacy and safety of the FDC RMV in the patients who were previously uncontrolled and dual drug therapy of metformin plus SGL2I2 or metformin plus DPP4I. Next. Forever trials. In this efficacy and safety of the combination of remagliflozin, etabide, and vidiliptin as a fixed doses in patients with type 2 diabetes mellitus, a randomized active controlled double-blind study, forever studies. Significant changes for the baseline in HbA1c levels in both groups. At the end of the study, duration of 16 weeks, there was a statistically significant change from the baseline HbA1c levels in the both the groups 1.46% in the RV group and minus 1.36% in the EL group. Significant changes for the baseline and FPG and PPG levels. Is the safety of the hemoglobin in comorbid conditions. Novel evidence of the hemoglobin is the chronic kidney disease patients. A prospective multi-center randomized non-inferior study of to evaluate the effect of the hemoglobin 100 mg was a dapagliflozin 10 mg. In the addition to standard care in the patients of type 2 diabetes mellitus with a chronic kidney disease is the methodology type prospective and randomized duration 6 months. Participants 150 patients and EGFR equal to 25 ml 1 per minute and group allocation hemoglobin group 75 patients and dapagliflozin group 75 patients. Remo CKD result. Change in the HbA1c and FPG and PPG at 12 weeks, 24 weeks and compared to baseline. Remo CKD result. Summarize of non-inferior parameters to determine hemoglobin and non-inferior to dapagliflozin. Here is the difference between hemoglobin and dapagliflozin. 15% of the sustained decline in estimation glomerular filtration rate at 24 weeks in hemoglobin 9.46% and the dapagliflozin 6.67% only. But in reaching end stage renal diseases, sustained EGFR 15 ml is hemoglobin is 4% and the dapagliflozin near to 3%. No cases with CV or renal death when added to the current background therapy patients EGFR less than 24 and more than 75 ml. Here the overall adverse effects of hemoglobin is 26% versus dapagliflozin 24%. Thank you, doc. Thank you.
Hello. Hello.
Hello.
Yeah. So we are done with the session, sir. Hello, sir. Can I conclude the session?